Hello, Dr. Chet here. Welcome to Sarum Health Group. Thank you for all your support, particularly over recent months. It's been challenging to say the least. We're going to run a short video about flu or influenza. We hope it's informative, and if you have any questions, please ask the clinician when you meet them in a few minutes' time.
Hello, I'm Lauren. Influenza, or simply the flu, is caused by the common influenza virus. It is one of the most common infectious diseases. Almost everyone has had the flu at some point. High fever, runny nose, sore throat, muscle pains, headaches, a coughing, sneezing and feeling tired. It's terrible, you'll remember.
Hello, I'm Penny. The good news is, it usually improves, but for certain groups of people, flu can cause serious complications, such as pneumonia and even death. It's especially dangerous for babies, pregnant women, people aged over 65 years and those with certain medical conditions. So even if you're healthy, it's important to get a flu jab to protect others.
Hello, Matthew here. The flu spreads when a sick person sneezes or coughs, sending thousands of virus containing droplets into the air. If they're lucky, these viruses might land directly on another person's nose or mouth. Well, lucky for them, not the person. But more often, they usually end up landing on nearby objects like a table. But that's not the end. The flu virus is very hardy and can survive for hours in the environment. This means hours later, another person touching the table may be contaminated by the virus. To make matters worse, a person may be contagious the day before their symptoms even begin, and up to 2 weeks afterwards, even when they feel so much better. So if you don't want to feel awful for a week, or maybe make your family, friends or co-workers sick, the best way to prevent the flu is to get the flu jab.
Hello, I'm Jules. The NHS offers the flu vaccine free of charge to people who are at the highest risk of complications. This includes pregnant women, adults aged 65 years and over, children aged 2 and 3, children in reception, years 1 to 7 at school, and children and adults with certain medical conditions such as asthma, COPD and heart problems. It's also available to those who do not meet any of these criteria but live with or care for someone within these at-risk groups.
Hello, Charlotte here. Getting vaccinated is easy. For adults, the flu vaccination is given as an injection with a small needle into the upper arm. It only takes a few seconds. The flu jab contains the types of influenza virus that are predicted to be the dominant ones this winter. This year, the NHS recommends adjuvated trivalent influenza vaccine, or ATIV, for people aged 65 and over, and egg-grown quadrivalent influenza vaccine, QIVE, or cell-based quadrivalent influenza vaccine, QIVC, for people aged under 65 years. And these are the vaccines we're offering at Sarum Health Group. In children, the flu vaccination can be given as a nasal spray. This is pain-free. Usually it needs to be given once, but for children with certain medical conditions, it may need to be repeated a few weeks later.
Hi, I'm Amanda. I'm here to tell you about the side effects from the flu vaccination. Fortunately, there are very few side effects from the flu vaccinations. Your arm may be a bit sore, you may have a mild fever and achy muscles for a couple of days. Serious side effects are very rare and it's not recommended for people with life-threatening egg allergies or a history of Guillain-Barré syndrome. Remember, you cannot catch flu from the flu jab. The virus inside the vaccine is dead. It can't infect you, otherwise it's good to get vaccinated.
Hello, Victoria here. To wrap up, the flu jab is recommended to everyone over 6 months old with a few exceptions. The flu jab is the best way to prevent flu. Getting vaccinated also decreases the chance of you passing the flu to someone else. Therefore, the more people who are vaccinated against the flu, the less people who will contract and spread flu. This protects those who can't get vaccinated, like infants under 6 months old. It's good to get vaccinated.